Hello, guy. This is Dr. Huynh. Live stream. I want to have 5, 10, 15 minutes. If anybody have any question regarding to dentistry, implant dentistry, braces, in veneer technology, anything like that, you are feel free to raise your hand, type in the comment below that you have question about that. I'm more than happy to answer your question. So I see one person watching. I'm really encourage anybody who have any question. Feel free to uh, jump on and ask me questions. Again, this is a live stream, 15 minutes a day. You can ask him any question regarding to implant dentistry, braces, and veneer. Especially lately, I've been posting a lot of instant veneer. Now, I just want to go ahead and jump right in at we talk. And anybody have any question, feel free to let me know. Now, I'm going to talk about implant dentistry. Most of us, especially missing one or two teeth and thinking about whether you want to do implant or bridge. Now that after 10 years of doing dentistry, implant dentistry, and 20 years of doing general dentistry, I realized that implant dentistry or fixed prosthodontics, um, there is pro and con. Sometimes implant, when you place on a certain patient, it works just fine, and sometimes it doesn't work on the other patient. So what the reason? Well, I'll tell you the reason. The reason is majority of time the implant is just basically a titanium screw into the bone of the patient, and that we do that. The orthopedic surgeon, they place screw onto your bone when your hip bone, your knees bone, when you have a fracture or you have a hip replacement. They do that, and it just works fine with the titanium. But the reason that sometimes it fail is because of the your body doesn't take it. Autoimmune disorder. Um, you have the issue with autoimmune disorder. You have pre-diabetic condition. You have titanium allergic reaction. You have many other problems inside your body that can make your implant fail. Sometimes when you have a diabetic, it delayed healing process. When patient have the implant, it take longer to heal. When it take longer in here, it increase the risk of opportunity for the bacteria to cause reinfection of the implant. That's why your implant can fail. Or sometimes you have pre-existing conditions such as gum disease. The gum disease is a condition where you have a chronic infection of your gum bacteria. You are very vulnerable for reoccurrence of the bacteria grow into your mouth, and it chronically it cause the damage to your bone, the bad damage to your gum, and eventually damage to your implant. That's what your implant can fail. Any the other problem is if you're a smoker, if you smoke a lot, you the nicotine will cause a vasoconstriction into your gum. So when vasoconstriction basically stop the ability to pour the blood into your circulation system, especially in your bone area where you had the implant surgery, and that's delayed the healing process of the implant, and the implant doesn't integrate into your bone, and that's where um, the implant can fail. So a lot of problem that can cause the implant fail, and so sometimes the only way for us to know is actually placing the implant and do the best, but we have to rely on the body, the healing process of your body, the natural healing of your body. So that's the key. So just going back to summarize about the implant dentistry is that majority of time it work, but some minority population patient will not benefit for the implant. And there's a list of condition that it can cause the implant fail. And it varies from patient to patient. Sometimes the patient smoking can still have the implant, and sometimes the patient have diabetic still can have the implant. Sometimes the patient have a other medical problem still can have the implant, and the implant doesn't fail. But then the other patient who have pre-existing conditions similar like that will fail. Hard to know. The only way to do is if you have to take a risk, like taking a risk to pay for a big amount of money for the doctor to do the work. And if it work, it work. If it doesn't work, that's we can't help it because it's just part of your body healing process. So in general, some people will benefit for implants. Some people may need to have just denture or bridge, which is the connection between two natural teeth together, versus doing the implant right in the middle of the two natural tooth. Or sometimes you see in the a lot of cosmetic dentists or advanced surgeon, they would take all your teeth out when you have a lot of issue with your teeth, like gum disease, uh, cavity, everything like that. That we can do that. We can take it all out at the same time and place implant and eradicate all the bacteria inside of your mouth. And usually, sometimes it works because we eradicate all the possibility of bacteria that cause the bone loss or causing the cavity in your mouth. Eliminate all of that by having completely total teeth removing with uh, new implant in and suture and close up everything. So hopefully that can work as well. So it vary from situation to situation. The advanced doctor who do surgery, he can evaluate the benefit of having uh, you know, full teeth extraction and denture, and sometimes you will have to weigh the pro and con between the risk of doing all teeth extraction and the risk of keeping some of your teeth remaining. It really based on the skill of the clinician and also the rationale behind the economic standpoint, the financial budgets, whether you want to spend a lot of money into doing major treatment and hope for the best, or doing a minor treatment and hope that you can still use some of your natural teeth. Again, dentistry have changed a lot of technology allow the dentist to do a lot of different things. And so feel free to get your dentist's attention and ask those questions. Okay, so far nobody have any question. I spent almost 8 minutes online and really excited. I hope that next time I'm doing live stream, if anybody have any question about implant dentistry, braces, Invisalign, whether Invisalign benefit or braces, it's all depend on your situation. And the reason that I still encourage patients to do regular braces is because it's actually a lot more affordable than Invisalign. But it's actually because Invisalign, basically you going to take this responsibility to wear your liner, to wear your Invisalign tray. If you don't wear it, it's not going to work. And but with braces, the dentist is going to be doing the work for you. And every time you come, he can, bend the wire and change the wire and do all of that. It's really more affordable with regular braces, Invisalign or Clear Correct or clear aligner, all those good stuff. But the lab chart the dentist have to chart the patient. So overall, the benefit of Invisalign or Clear Correct or Clear aligner in a way that you don't have to see a dentist quite often. You do it yourself, uh, and with the uh, braces, you have to come to a dentist every month. Uh, but it's good thing is the dentist, when he sees you, he can check your mouth and really know how to turn your tooth, rotate your teeth, whatever needs necessary to facilitate your case faster. When you do Invisalign, you really rely on what the lab planning for you. And sometimes it's great, sometimes it may not be great. And so sometimes we have to rescan your jaw and redo your Invisalign or clear correct or clear aligner again. Uh, so and the cost can be more in the in those clear braces versus brackets put on, silver bracket put on. I'm hoping this is a very fair live stream tonight. I hope you have a blessed night. You feel free to comment below, ask me a question regarding to denture, implant, braces, anything you want to know, including instant veneer. I hope you have a wonderful night. God bless everybody. Take care.